Okay. So prynawn da poib yn croeso i'r cyfarfod heddiw. Welcome to Merthyr Tudful County Borough Council's Healthier Merthyr Tudful Scrutiny. Today, the 25th of November. Please note that the meeting may be recorded and will be recorded and broadcast by the authority's internet site. The images and sound recording may also be used for training purposes. Before we move on to the formal agenda, I'd like to welcome Mr. Stuart Bowen, who is, it's nice to see a new lay member on the committee. We haven't had one for quite some time, so Stuart, welcome to Healthier Scrutiny. Okay. If we can move now on to the formal agenda, and any apologies for absence?
And apologies from Alex and Joanne.
Yeah, that's Alex Beckham and Joanne Llywelyn. And I understand Rob is will be involved in the report in their absence. Are there any declarations of interest on the items before us today? Okay. So the first item on the agenda is item number 3. That's the minutes of the meeting held on the 14th of October 2025. If we just go through the minutes first of all for accuracy, are there any errors or matters which need to be amended within those minutes? Okay. Would someone who was present move them and someone second, please?
Chair, I don't feel that I should move or second because I left the meeting, so I'll leave them up to my colleagues. Thank you.
Could somebody move?
I'll move them then.
Yeah, Councillor Isaac moved them and
I'm happy to second.
And Councillor Thomas a second. Okay, thank you very much. If we move on to the next item, before we move that, welcome Matt to the meeting. We've just started and running through the, we're on item number 4 now at the moment.
Thank you, Councillor. Thank you for the invite.
Item number 4 are the action logs. I don't believe there is anything specifically to report on that matter, unless members wish to raise anything. No? Okay. So we'll move on to the reports, and the first report is item number 5. That's the Adult Community Learning Partnership Progress on Recommendation. I'm not sure who's taking this, whether it's Louise is introducing it or Chris.
I'm happy to just quickly introduce it, if that's okay. If that's
yeah, thank you, Councillor Mayan folks. Thank you.
Okay, so a brief summary then of the Community Learning Partnership progress on the recommendations. So the Merthyr Tudful Adult Community Learning Partnership has made notable progress against ESTIN's 2024 recommendations, particularly in governance, strategic planning, curriculum mapping, website development and learner engagement. While many foundations have been strengthened, there are some key systems and processes that require further development to ensure the partnership can be removed from the ESTIN follow-up by the anticipated date of September 2026. So you can see in the report there are some positives and strengths noted. Strong governance and partnership working, improved strategic planning and mapping of provision, website and the prospectus launched, increased learner participation, and workforce and collaboration foundations strengthened. There are areas for improvement as they're contained in the report, and detailed in the report is next steps. So the recommendations of this report is in 2.1 for scrutiny members to note the progress made and debate the content included in the next steps identified within the report. Thank you, Chair.
Okay, thank you, Councillor Mayan folks. Chris, do you wish to add anything to?
No, I think it's a very good summary of exactly where we are. Thanks very much.
Okay, if we move first then to any questions, please. Councillor Jenkins?
With the launch of the ACL partnership website in September, how do you feel potential learners coped and assessed what it was set out to achieve, and what percentage still ask for a hard copy?
I think in terms of, it's difficult to understand exactly how individuals cope. We tested the actual website with community members involved in adult learning, and it was seen to be as a welcome addition, particularly across partners, to provide the opportunity to actually share the information on courses available across all those partners, and to use that as a foundation building block, really, for it to be increased in the future. We've put hard copies available in a number of community venues, educational venues throughout the county borough, and I don't know that we had any requests for individual hard copies.
We have had requests for copies. What I would say is we wouldn't be able to tell you how many of the copies have been taken away, and a percentage of what we've had printed to be handed into the community, but we've had further requests from partners for additional copies. So they're obviously being taken.
Okay.
So I think it's important that those requests are coming from partner organisations or community-based organisations where people are accessing that information then.
Lovely. I've got a second question,
Yes.
is that okay? When it mentions skills employers need rather than what is on offer, how has this been addressed?
I think we're probably going to get two competing elements coming through here in terms of, if we ask the community what opportunities they want for adult community learning, we're going to have a situation whereby we're going to have to consider whether it's viable to put on fee-paying courses rather than the Welsh Government sponsored courses, which are mainly around maths, English and IT development. But we also need to make sure that those maths, English and IT link up with what is it employers want out of those skill sets. So there's a piece of work that's being done, and it's to be led by the college, on identifying the main employment trends going forward and what actual courses are on offer in the college to meet that and what sits below that, so that we can look at it as a pathway through. So that piece of work is going to be quite substantial about identifying the employment needs in terms of the employment occupations that are going to become available in the next few years, moving forward, really. And it's going to be trying to dovetail those together in partnership with the college, so we create that progression route through from very low level learning and people understanding those next steps and where they can go for those steps.
Lovely, thank you very much.
Stuart?
Yeah. I was there now about 2 years ago, and I was told I wanted to go back to college to go on a bit further with my computers. I love computers, and they told me straight, they said, "You're already in first year, but after that year you can't go any further because you're not going to complete the course." I wanted to go further, but they're not allowing people to, like my age, to go any further. Alright, for young people like just coming out of school, 16, 17, but they're not, my age 40, they're not allowing me to go any further with my education.
I think in terms of from an adult community learning perspective, we are funded from Welsh Government to go up to a level 2, and that's where our ceiling stops. The question then is what opportunities exist level 3 and upwards in local colleges, which they could fund out of their FE budgets then. I don't know on the funding within the colleges, but we're only funded by Welsh Government to provide that up to level 2, and that's where that would cease within ours, which is why the importance of having those mapped out progression routes that we've been doing a lot of work with the college and partners on, so that we can understand all of those progression routes, and then equipping the individuals who teach the community what those progression routes look like, so they point people in the right direction.
Yeah. Thank you.
Okay. Councillor Ian Thomas?
Thank you, Chair. Item 4 in the report, R1 to R5, all refer mostly to the importance of engagement. Yet the proportion of engagement funding included in the overall funding has been reduced from 10% to 5%, which they seem to contradict each other. Can you explain the rationale behind this, and how do you separate the two, the engagement funding from the other part?
Yeah, I mean, I can't really talk to the rationale because, as you say, it goes completely contradictory. We know across Wales, and we've had exactly the same issues, that we're struggling to get individuals into programmes because of the very nature of them. The maths, English, IT, they're not the sexiest opportunities people want to take on. Welsh Government have moved the responsibility for adult community learning over into an organisation called Merthyr. And they have made the decision to reduce that funding. It also goes contrary to what Estyn have actually done within one of their recent adult community learning thematic reports nationally, which has stressed that the engagement element is absolutely crucial to getting people who have disengaged from learning and maybe disengaged from employment back into, and on that first rung of enjoying something that's got a learning ethos behind it, and then moving them gently up through the qualifications. It is going to be extremely challenging for us. We've seen a big increase in our engagement this year in terms of as a local authority. That was planned and I can't say expected, but hoped for by the work that we've done. And that engagement resource is going to be the loss of that engagement resource alongside the potential loss of shared prosperity funding next year, because even the 10% in the Welsh Government funding is nothing in comparison to the investment we've had over Shared Prosperity Fund or Multiply over the last couple of years to try and stimulate that engagement in learning. So it's going to significantly impact upon the service as we go forward, both the loss of shared prosperity potentially and the loss of the engagement funding within the Welsh Government funded by Merthyr. It could significantly impact our numbers going forward.
Thank you very much for that. I've got one more question, Chair.
Yes,
Do it now?
Yes, please.
Item 7.9 talks about the need to secure replacement funding due to the loss of the UK shared prosperity funding. And this will affect the capacity to deliver wider learning opportunities. How will you go about trying to replace that funding?
I think it's going to be extremely difficult and challenging. The element about the wider learning is that this funding is not restricted by just maths, English and IT in many respects. It allows a wider engagement. We will work with partners to look at what opportunities exist out there. There are some funds I know the college have just put in for in order to look at opportunities, but it's going to be extremely challenging. We're going to have to work in partnership because as a local authority, obviously we're often excluded from numerous what you would class as voluntary sector or third sector funding, and there's not going to be any more funding coming through Welsh Government. I have to say that, it's not a dead in the water that shared prosperity is gone at this time, but it is anticipated that would be what will happen. It's going to be challenging, but it's going to be about working in partnership with local community organisations who maybe want to put on courses and actually can have better access to funding streams through the third sector than what we get as a local authority.
Right, thank you very much. That's all, Chair. Thank you.
Thank you, Councillor Thomas. Councillor David Isaac.
Thank you, Chair. Taking 5.2.4 recommendations for. Yeah, number of learners with the core council provision, number of learners has risen by 20%. Now, how many learners is that? Because it says Law Estyn acknowledges the progress, that we need work to keep these figures going upwards. So what would be a success, not in a percentage, but in actual people?
Off the top of my head, David, I think it's around between 20 and 30 new learners over and above what we've had the previous year. So I think we were around 100 learners last year within adult community learning just for the council element. So I think it's about an additional 20 or 30, about 20, 25, something like that, I think. But I'd have to dig the proper numbers out and provide them to you later on.
Okay, thanks very much.
Could you make a note of that, Jane, please? Yeah. Okay. Any further questions?
Yes, myself, please.
Councillor Claire Jenkins.
Okay.
Okay, Claire Jones, see.
Plus. Thank you, Chair. 7.4, develop and implement an online community consultation to gather residents' views of the learning offer currently available. So in that report, we're talking about not having money, losing funding. We're on about developing, which is going to cost. So one, have we already come into that to get the development of whatever consultation, online consultation you've got? That's my first. But then I'm asking, we live in a society, not everyone has got the pleasure of having a mobile phone or if they've got one, they haven't got the internet. So are we having a backup plan to have a consultation other than online that will give, people the opportunity to be able to answer questions, whether it be face-to-face or whether there'll be a portal in the college where they can just press some buttons so they haven't got to use anything of their own. So that's my question. And thank you, Chair.
Thank you, Councillor Jones.
Yeah, I'll try and bring those into the two. Yeah, in terms of a backup plan, we would probably be doing pop-ups in community locations as well in order to try and get face-to-face and to get some sort of spread across the county borough. It's probably not worded as well as it should have been by myself within in terms of that. So that will get an element of the face-to-face. In terms of the other part I mentioned, which is about reducing budgets and the development, what part of what we're looking for is to understand what people are asking for. So if people are asking for carpentry, is there something we can do using maths and English through carpentry as a potential hook to get people in and allow them to move on? So probably the easiest one to explain is plumbing's available in a local college. If we can get people who are interested in plumbing to start their maths and English, can we then have an agreement with the college that they get a guaranteed interview for a place on a course then to carry on their plumbing in that, so that we create that progression pathway. So it's trying to gather what the interests of the community are without saying we will offer a plumbing qualification or we will offer this. It'll be about linking that through a progression pathway, really. Because you're right, there's not going to be the money for us to suddenly expand, but it will also give the college an opportunity to see what else they should be offering or could offer through the FEX element. Because this is a partnership and not just the local authority element, it would also potentially influence what the college could offer as an adult learning programmes in the night outside of just ESOL that they provide at the moment.
Thank you, that's really appreciated. Thank you, Chair.
Councillor David Isaac again, please.
Can I just go back and touch on what you were saying about the people who need to do maths, etc.? I was going just to make a comment on the college that, in a way, they do let learners down as they started some courses. Take, for example, welding. They'll do levels 1 and 2. But when it comes to level 3, if the learner hasn't been lucky enough to achieve the qualifications in school, they turn them down because they haven't got the qualifications to move on. So is there some sort of support, as was said, that we could do to get the learner that qualification so they can actually do the final part and get something out of, say, welding or carpentry or whatever is needed? I noticed that other colleges around the area do carpentry and plumbing, but nothing is coming through to Merthyr at the moment. And perhaps nobody can answer that on behalf of the college, but that is what I've seen in the past.
Yeah, you're right, David. I couldn't answer on behalf of the college. What I can say is we've mapped all of the offer available, and we're trying to bring that now together to understand the progression pathways and the blockages and see whether there's something we can do as an adult learning partnership to improve that situation. I think that's all I could say. From level 3 upwards, I'm not entirely sure what those progression opportunities would look like at this moment.
Okay, thank you. Okay,
Thank
Councillor Isaac. Any further questions? I've got a couple. Most have been covered by my colleagues, really, regarding the reduction in funding and engagement with learners, which are very important, I think, issues, Chris. There was one question: why don't they issue a why didn't I think it's 5.2? Why don't they issue a formal report at this stage then? Or why didn't they? Sorry. Dan?
Yeah, I can pick it up. I think it's part of the estimate process is they can come out and do a touch point review with us, and part of their process is they don't offer a formal report on the back of that meeting. The meeting was held with all partners of the partnership, and we always took our notes through the partnership and through the meetings, and obviously our feedback is based on the partnerships.
I think part of that is because they only see it as an interim arrangement.
Yes. Yeah.
Because it's an interim visit, they'll give us a formal feedback when they come and do the next assessment in, which was a year from the time that the being put into the follow-up category. So they'll come and do that, which we expect to be this summer of 26, and they will then do a full-scale inspection again and give a follow-up report and let us know whether we'll actually come out of the follow-up category. Yeah.
Okay, thanks. I wanted to move on to the action plan. I had a couple of queries on. In the matrix, there seems to be a lot of more comments in there. Could you explain the reason why that's happened? I apologise for the massive copy I didn't give them.
I think the element is, I'm just having a quick scan through in terms of is we've got different leads for different areas.
Yes.
And there's different varying amounts of progress on different priorities.
Yes.
So some of those ones where there's no comments at the moment, things will be ongoing in terms of the development work, but actually it's not being fed back up to the strategic partnership yet to say, this is now where we're at, and are we happy to sign off that progress has been sufficient enough to actually turn it from a red and amber to a green, or to move the categorization, because we've set it up that no one partner can just say that's done. It's now reviewed by the strategic board on a periodic basis, with each subgroup having to report up and say, I'm recommending this changes, and then comments are added to the document as we go along.
Okay, thanks.
So it's a live work iteration. You could see this again in a couple of months and it might change again. Yeah,
it is a follow-up from that. Obviously, the action plan was agreed in July 2025, and there were some dates set then. I think there was the complaints process development agreed by September 25. I think that's 25 was, I think, wasn't it? Are we on track with all those dates which would have been set then? Are you on track, or are there any which have slipped?
I would say that there are a couple that have slipped, and that's been down to prioritisation and speed of addressing the amount of work that was needed to be done, particularly around getting the partnership strategically in a place that partners owned the actions individually. I think if you look at recommendation 5, where we've reported there hasn't been significant progress, one of the partners came to us afterwards and said, yeah, we accept that we haven't done as much as we should have on this. We've underestimated the amount of work to be done, and that's meant that some of those dates will have slipped. So we keep it under constant review by the strategic partnership, and whilst it's not good that that's happened in terms of recommendation 5, it's good that actually the organisation has taken that ownership to say we now need to address that, and it was noted by us and by Estin. We knew that going into the follow-up into the meeting. So yeah, some of the dates have slipped slightly, but there's nothing that gives me cause for concern at this point in time around those dates.
No. Okay, thank you. I think that's all questions I think have been asked. Any comments, please, from members? Councillor Jones? Claire Jones?
Thank you. I would just like to say, thank you for the report. And I think it is a marked difference from last year. So I think you all need to be congratulated on that. I look forward to seeing what happens in future, but I would also say on the bottom it does say on 8.1 that you have improved aspirational Merthyr, so the contribution with wellbeing objectives is with aspirational Merthyr. So my comment on that is at some point perhaps it would be idea if all of us got together. You know, I think that would be beneficial. So, but again, I would just like to say thank you very much. It's much appreciated and well done. So thank you, Chair.
Yeah, very good suggestion there, Claire. There's something we may look at a joint sort of approach when we perhaps get nearer the deadline.
Yeah, there's a number of areas of ours which cross over.
It cross over.
Yeah.
Thank you, Chair.
Any other comments? No, I'd just like to echo what Claire has said, really, that it's a very comprehensive action plan. It's good to see that the joint working has improved vastly from what you've said within you to what it was back 12 months ago then, really, wasn't it? So again, pass on thanks to thanks to yourself and to your staff regarding that.
Yeah.
And obviously we look forward to being in a position where Esther will not be taking an interest.
I have to say, Chair, for the record,
In the future.
it is testament to the change we've seen in partners and ourselves in terms of making sure they take some of that ownership. They have willingly run down that road with us now and have taken a full share of both the workload and the responsibility for it. And it was noted by Estin recently, and they said they can actively see the difference in actually the partnership now, and that although we've made it very much around the statutory partners, they've understood that and thought it was the right thing to do and basically to start again. So, hats off to both the statutory partners, the College and Adult Learning Wales for committing to the shared approach.
Thank you, Chris. So before we move on to the recommendation at number 2 in the report, are members happy that the committee has addressed the issues raised in the report and it added value, that us looking at this matter has added some value to the matter?
Absolutely, Chair.
Everyone in agreement? So obviously the recommendation is that scrutiny members note the progress made, which we have, and debate the content, which we have, including the steps identified within the report. Okay? Is everyone in agreement with that recommendation? Okay? Yeah. Thank you. Considerate, or who wish to leave?
She's on the free running today.
Quickest game.
Thanks.
Thank
Thank you very much.
Thank you.
Okay, members, if we move on then to the next report, which is the Integrating Health and Social Care for Adults in Merthyr Tudful. Again, Louise, are you leading in on this?
Yes, Chair.
And then Rob will follow on, and obviously Matt is available for, Matt Jenkins from the Health Board is available for any questions in relation to the report. Thank you.
Thank you, Chair. Before I do the quick summary, I just wanted to quickly point out there was an error in the report in 5.4. 5.4 states in brackets right at the end of the sentence, see attachment as annex. It's just to say that there was no annex, so that was just an error. So apologies for that, Chair. Just wanted to clear that up.
Well, thank you for the clarity on that, Councillor Maidvaux. It was raised in the pre-meeting which we held last week.
Okay.
Thank you.
Okay, so I'll give a quick overview. So this report then outlines the progress that Merthyr Tudful County Borough Council has made towards integrating adult social care with NHS services. It reflects national policy and direction and growing local need. The report highlights positive examples of joint working, but identifies those barriers that remain, and it sets out the new phase of work under the Regional Partnership Agreement and the Integrated Community Care System. So foundations are strong and community voices are shaping the model, and the report does reflect on existing models that we have which are working well, such as Stay Well at Home. However, as stated in the report, there are some challenges which are significant, such as structural barriers, financial pressures, and the complexity of culture change across organisations. So highlighted in the report are some of the positives and the strengths. As I've stated, is the clear alignment with national policy, the use of lived experience and public insight. There's been conversations with the public and regional hackathons that have shaped the approach. As stated, we've got the successful joint working and thing in place, such as the Stay Well at Home, and that's a good strong example of effective integration in terms of preventing hospital admission. It supports safe and timely discharge, promotes independence, and brings those teams together. And that model is considered as a successful one and a successful foundation for scaling up. Also in the report is areas for improvement and challenges, some of which I've said, and then highlighted in the report then there's next steps. And Chair, like you've stated, we do have Matt Jenkins with us today. So Matt, forgive me if I get your job title wrong, Integrated Services Director for Cwmtaf Morgannwg Regional Partnership Board. I hope I've got all that right. So if there's any additional questions, and due to Alex being on leave, I know we've got Rob on the call with us as well. Thank you, Chair.
Thank you, mate. Councillor folks. Does Rob or Matt wish to, well, Rob, I'll ask Rob first. Do you wish to come in at this stage, Rob?
Yes, thanks very much, Chair. Just to reiterate really, Councillor folks, we are on the pathway in terms of integrating our services with health through the Section 33 agreement and working with Matt and other colleagues. Certainly we've looked at this in terms of practical stages so that we can make sure that the citizens of Merthyr see a definite benefit in terms of hospital discharge. That started in terms of recruitment. So we've looked at reviewing our services through the year of 24-25, and we were able to facilitate then extra social work staff in the hospital discharge team. The integration of a senior practitioner within the hospital discharge team as well. And then we're now in the process of retendering of services so that we can look at a straight to service model for people being discharged from hospital, so that people can be effectively discharged following a trusted assessment into their own homes or into communities, so that then further assessment then can be done in the places where they wish to be. In terms of our strategies, we've incorporated that in our strategy for 24-25 to ensure that our assessments and working with people are based on an outcome focused model rather than a deficit model, and that's where I think some of the cultural changes which we need to look at is, as Councillor Vokes has mentioned, in terms of stepping away from people coming to us and saying, oh, I can't wash and dress anymore. Well, what actually is it can you still do, and what can we support you with? And moving away from the medicalised model. In terms of our reporting structures, we've just reported back for our last quarter to, in terms of discharges and delays to Welsh Government, and our delays are significantly lower. We don't have significant delays in reference to the allocation of work to our workers in terms of to undertake the assessments. There are some challenges in terms of completing complex assessments with health in terms of getting everybody into the room, but by working together and the instigation then of hospital hubs where we're talking on a daily basis in terms of Mr. and Mrs. Jones, what is it they want, how can we effectively discharge people from home? That is having a dramatic effect then in terms of our successes from delays compared to our partners, and also then in terms of people feeling that they're being listened to and being able to be discharged home. The next step, as I said, once we've retendered some services in terms of straight to provider services or straight to integrated services from our hospital at home structures, we're working with health to look at a hospital at home ethos where people can be supported as an alternative to being admitted to hospital, and we're also looking at how we can use technology in terms of the Cobal systems and other integrated technology then to keep people at home safer and longer, which is going to be a benefit for them and obviously a benefit for us in terms of the provision of services because we're providing them in a different way. In terms of the final step, obviously in the challenge in terms of real time, we're coming into the winter months and into Christmas. We are working with our colleagues in health to make sure that we've learnt lessons from last year and the year before. It's been mentioned in terms of the stay well at home services and integrated. We also provide integrated services in mental health, and we're very successful in terms of ensuring that we're compliant with the care and treatment processes. So it's about how we can use those examples of good practice. We've prepared some case studies, which we can share with you as well. And if you've got any specific questions in terms of how practically this can be benefits to the council and obviously to citizens of Merthyr, then please say. And if you'd like me to exemplify some of the data, I've got some of the data preloaded obviously onto my computer, which we can share with you as well. And thank you for time.
Thank you, Rob. Matt, would you like to add anything to that?
May I just, Councillor, just add a word about my role and where I fit into the scrutiny process. Thank you to Councillor Oakes for the introduction. It's an overly long job title, I think, but I work to the regional partnership. So to the 4 statutory organisations really that are at the heart of the regional partnership, Merthyr Tudful County Borough Council being one of those. So very much here supporting your own organisation as much of the partners in here, and it's great to be working alongside Rob and Lisa and indeed Councillor Minette Oakes to deliver this programme around integrated community care that's so important, I think, for the growing number of people living with frailty in our communities. Really need to step up our level of support to them, and this programme needs to make a big contribution towards that. Thank you.
Thank you, Matt. We'll go on to questions. I can see Councillor David Isaac has got his hand up. I'm sure there'll be other people wanting to come in too, but I see David's got his hand up.
Thank you. How do you feel the pressure on our organisation is from the hospital needing to clear beds to discharge? Is there undue pressure being put on the system? That's the first question.
Okay, Councillor Isaac, if I can answer that. So firstly, the pressure to discharge people from hospital it obviously is constant, because what I think we must be aware of is that while somebody is in a bed, if they don't need to be, then somebody else who we may know, or maybe you or I, is waiting downstairs in accident emergency, or in their own home waiting for an ambulance to pick them up, and that could be anywhere between 7 and 72 hours. So firstly, we take that responsibility and we try to share that, which the Section 33 agreement does. Secondly, what it's about, I think, which is a key thing, it's about safe discharge rather than discharge. One thing which we've learned throughout the previous years is about accountability. When a staff nurse says that Rob Wigmore can be discharged home today, but he needs to be discharged home safely and following the processes to ensure the services are in place. We certainly don't receive some of the undue pressure that some of our counterparts in England have, where the local authority is expected to pick people up in hospital when they've been already discharged home. So where people are being placed from a relatively safe place in terms of a building to an unsafe place in terms of their own home without services. So we're not at that level yet. And I think the integrated approach that we're doing, which obviously Matt is wonderfully supporting, allows us to have that open conversation with our partners in health to say, when people are discharged, the most effective way is to be done safely. Does that answer your question, please, Councillor Isaac?
Yes, in a way, because my background is in health,
yeah.
And I also going back at least 4 years ago now, was concerned about the unsafe discharges into the community, and they used to be known as failed discharge, and
That's right.
that person was back in hospital within 8 hours, perhaps. So that was my first consideration, and you've answered that quite nicely. Can I just go on to my second question, Chair?
Yes, David, no problem.
Thank you. How prepared do you feel you are for the Christmas rush? Now, when I was working in the service, we always had 2 to 3 days before Christmas itself. We had what we used to refer to put Granny in hospital day, whereas everybody'd phone up and try and get their elderly relative admitted into hospital because they wanted to have Christmas and the holidays free. Do you feel we are prepared for this rush and we can cope?
Yes, Councillor Isaac. So what we're doing this year, which is new for this year, is that by working together as a regional approach and with Welsh Government, we're starting from the week of December the 2nd, a sprint, or it's called a sprint, which is what would an ideal 2 weeks look like in our hospitals. Who needs to be in the hospitals, who doesn't, and what services are needed to be put in place to effectively discharge people. So that's starting early this year from the first Monday of December. And what we're doing as well is that I was just doing it today, is giving our response then to health in reference to the Christmas period of when the council offices are closed. Our intermediate care services will be running as normal for 365 days to give that support, and obviously inform all the members of staff on the wards the complications that we'll have. So, for instance, in terms of packages of care, our providers will have already started looking at their rotas to provide packages of care for people to be discharged from hospital or people who are at home at the moment. And we need to be reasonable then with ward staff to say that up until a point, which is a couple of days before Christmas, they may not be able to provide one-off care or things such as that, because the system would be full. They have put a contingency plan in place though for emergency cases or people, so that if people do need to be discharged, there is some movement within the system, and we've done that within our intermediate care services as well. But you are right that our greatest risk factors just before Christmas are where families come and see mum or dad. They haven't seen them for a long while, and then all of a sudden then they panic and worry and fear that they need something there and then just before the Christmas period. So we're hoping that this sprint and also the arrangements with us, Rhondda and Taff, Bridgend, in terms of to be open and honest about the flex that we've got in community for our resources, will help then to minimise that. The other things that we are doing as well is to ensure, in terms of information within our GP surgeries, that if people can stay at home with supported GPs and community services, then that's preferred, because what we all know is that risk of infection in hospitals is high, and we are all aware of the risks at the moment in terms of the new influenza strains, and also COVID, unfortunately, is very prevalent within our hospitals.
Thank you. Okay, Councillor Isaac?
Yes, thanks.
Stuart, Bowen, I think you put your hand up, did you?
Yeah. I was in a meeting, I think it was April time. April might have been before, might have been just after April. And something came up. We were up in Bant, and we were talking about recovery colleges. Any idea what that means or not?
Do you mind if I call you Stuart, or would you prefer Mr. Bowen?
Okay. Don't mind.
Stuart. There's lots of different things about recovery colleges, but if you want us to find out, you were in a conversation in Vampt, were you?
Yeah.
Do you want me to try and find out, and then via the chair we can let you know that information? Is that okay?
But please.
Yeah.
Happy with that, Stuart?
Yeah.
Yeah, okay. Rob will get that information and supply it to us.
Great, thank you.
Okay.
Thank you.
No problem at all, Stuart. Thank you for the question.
Any ladies first, and then we go to the Council Thomas.
Yes,
Yes.
I think he,
We'll take one of the ladies, and then we'll go to Ian and then come back. No fight.
I'll go. Right, I'm looking at 6.3. Your bullet points. I'm gonna integrate your second bullet point to 1, 2, 3, 4, 5. Your sixth bullet point, because your second bullet point is more people will have needs met in the community in a timely way to responsive local integrated teams. And then the next bullet point I'm looking at is people, when they do pass, will increasingly do so in the place of choosing rather than hospital ward. So my question is, I mean, for the first bullet point, you know, what are you looking at with the teams? Have you got a full team covering all areas now? Because you didn't. And going into the second question then, you were saying that people can pass in the choosing. So with that, how is this implemented? Where if a person is requiring medication and they need it there and then, you can't just expect a nurse to drop everything to go to that next call. You know, relatives need to be made aware that when a person does need to have that important medication, so how are you going to cope with that? Because you're basically saying that you can take a patient home to die where they want. So I'm a bit concerned about that one, and how you're going to cope with the workload.
Okay. Thank you very much for the question. I'll deal with them in 3 different bits, if you don't mind. So in terms of the first question about meeting needs within communities, we've got, as you know, integrated services that provide services within people's own homes, and health are just starting their process of hospital at homes. Okay. If we received a referral which came through 999, where somebody needed to be admitted to hospital, those people who are waiting for ambulances are triaged by the clinical navigation hubs, which is part of the hospital at home service, and they're offered a service within their own home to see if they can stay there rather than coming in. The hospital at home service can provide intermediate care services or bridging services for that immediate period, and then they would liaise with us then as a local authority from our intermediate care services to provide that support or provide that assessment under the current legislation. So that's where that information comes from there in terms of the communities. Does that answer your question?
No, not really, because I'm asking, have you got enough staff? Because you were sending people home, and they were having the rapid response team going for the first 6 weeks, but then we were finding that patients were living in areas where there were no carers. So my question is, have you now got carers to cover all areas on that one?
So in terms of local authority provision for domiciliary care services, we don't have any issues in terms of the provision of care, except for some small circumstances within the south of the area, and we're aware of that. So what we've done in terms of the challenge is to look at consultation with all the providers so that we can reorganise the areas of Merthyr. And also we're retendering then so that the providers then can look at a block. We've got, I believe it's about 1,700 and something hours per week in most of the areas in terms of the tenders. And what we're trying to do then is to say for those areas, because traditionally in Merthyr, a home carer will do their round, so to speak, and walk it. Will start because they're providing services within their own local communities. In those areas then where we're having that difficulty, that's where we're looking at that retendering, so our providers can guarantee us that everybody will have equal access to those services. So we are aware in a small percentage of people in the south, but certainly in the north, east and west, we've got no reported instances of concerns in terms of abilities. And that's where we're trying to work then with hospital at home to see if there is any flex then in emergencies in those services. And I can see that Matt has got his hand up, so he may be able to also then provide some information in terms of that.
May I come in? Thanks, Rob.
Yeah, can I also, before you explain the intricacies of it all, Matt, can I just explain something, Gareth, as well?
Can we leave the officers for? Are you asking? We're on questions now, Councillor Isaac.
Yeah, I just wanted to clear up something that was asked about patients passing. And
I will go on to that.
We haven't come to that question yet, Councillor Isaac. Thank you.
okay,
Rob is still dealing with the questions in the first part of the question. Rob's dealing with.
Okay, no problem. I just thought I might be able to clear up something, that's all.
If may I add to Rob's comments about how capacity in the community really needs to step up and meet demand. I mean, there are lots of indicators that agree with you, Councillor, that we struggle. This is a comment across the region rather than Tudful specifically, to meet community need. We convey a very high number of older people as a health board area compared to other health board areas in Wales, and there are undoubtedly opportunities to avoid admissions by strengthening our community care services, particularly thinking of intermediate care. So alongside Rob's answers on carers, we've been doing some mapping of the intermediate care workforce. I think there's reference to the paper as well, that one of the pieces of work we've started as a region is to build a demand and capacity model as it's described. So to look at the trends driving demand, demographics, deprivation being the most obvious of those, and then to use that as a basis for figuring out what level of capacity we would need to provide in order to optimise our community-based services. So can we meet needs in the community? Can we advise admissions? Partly in response to Councillor Isaac's point as well, do we have the resources there to be able to expedite a discharge from hospital, where we know that a hospital can be a dangerous place to be if you're living with frailty, you've had all the clinical intervention that you need, and now you're ready to go home. We really do need to get those people moving as quickly as possible. So I think it's a fair question, and from Rob's answer, I think there's hopefully a level of assurance there. But we know that as a strategic piece of work for us as a local area in a region, we really need to understand the capacity that we need. And the intent with this whole area of work is to strengthen community services. For that reason, we need to be able to shift to the left, as I say, in terms of health and care policy to do that. So hopefully we'll be able to show you some of the results of that in future discussions.
Thank you, Chair. Sorry.
So in terms of your second question and of the place of choosing for people to pass or to die, it's a huge challenge. I've got to be totally transparent in terms of for this area. We know that our population is aging, and that we know that people are coming into hospital with a far greater complexity of medical need than they used to. What we try to do as a local authority is that the discharge to assess pathway tries to establish people's needs within their own homes rather than in the hospital, because that's a false reality within the hospital. So we try and provide services to people, even if we know that they're on an end-of-life pathway. And then what we do then is that we have that negotiation with health at a later stage then, if there is that evidence of end-of-life care, so that we can recharge our partners in health, so that the person and their families don't have to ask those questions. But sometimes that doesn't always happen, and sometimes families take mum, dad home because they love them, and provide those services, which puts them in a risky situation. And what we're trying to do is trying to make sure that our front doors are available, so the duty teams, the hospital discharge teams, so people can at least gain advice and information about what realistically can happen, so families can make choices with their loved one then, in terms of where they wish to end their final days. The last challenge then, I think, in terms of you mentioned about medication. So medication and medication at home services are under review by us and by the hospital at home service. The hospital at home service has a clinician, has a GP, so a GP can advise in reference to any medications, but certainly the challenge for us in the community pharmacy, which we negotiate with them via the GP clusters and also by the pharmacy services from the hospital, is that people are saying to us, and we as a local authority obviously can't address that giving of the medication. While I'm in hospital, why are you giving me all of my medication if I can do it myself? And that's a challenge that we're giving our hospitals. The other challenge that we give in our hospitals is how can we support somebody to remind them to take medication? Can we use technology? Do we need to use home carers? Do we need to use specialist services if there's time-specific medication? And how can we then ask our colleagues in health to provide quicker and more effective assessments within their own home for people who need continuing health care, so that a nurse then can be used to oversee that medication. In terms of pain relief, especially use of morphine and controlled substances, it's a real harder case for us as a local authority then to provide services immediately, because we obviously don't provide those services, but certainly we want to work alongside people so that people, again with my last point, can be supported where they feel more comfortable in terms of their last dignified days. Okay. Does that answer your question?
Yeah, thank you. I do welcome that because you know, I have recently dealt with a family who were unable to take a loved one home, and it was mainly down to the medication, and then being told that if anything had gone wrong there was nobody there, you know, and they kept that person in hospital, and that was their choice. But I welcome that one because I do believe that everyone does have a choice of where they would like to die as long as they're supported. Thank you very much. I appreciate that. Thank you. Thank you, Chair. Yeah.
Councillor Ian Thomas, then Councillor Julia Jenkins.
Thank you, Chair. Well, this has been pretty well covered by the contributors here. So my question ends up being a bit low key, but I'll ask it anyway. Item 7.2. There's a little statement in there saying we need to balance ambition and pragmatism. Could that, the pragmatism part of it, could that lead to any cutting of corners? And also, with relation to hospital discharge, is there a danger that social services staff might be a bit overwhelmed by a very strong medical discharge team from the hospital?
Okay. Councillor Thomas, if I can answer those two bits then. In terms of cutting of corners, one thing which we've all established in our integrated process, so as well as the Section 33 agreements, we've also been participating in between health and social services to increase our professional relationships. So it was called Partnership with a Small P, which myself and Matt were present on. So the one thing is about building trust in relationships so that corners are not cut. And in order for us not to cut corners, what we must agree on is our basic values in hospital discharge and providing support for people in communities, which is whatever we do safely, or if we need to manage risk, we do that with the person making choices for themselves. So in terms of discharge from hospital, it would be very unwise of me to say I can guarantee that every person being discharged from hospital is going to be safely discharged, and we won't have on a 2:30 in the morning on a Saturday when A&E has got a full waiting room, that we may not hear of somebody being discharged too early. We will. But what we need to do is that we need to have the understanding in terms of the foundation of hospital discharges to be done safely, and with support for services if need be. There may be some people, for instance, who may be vulnerable and make unwise choices, and therefore then we need to pick that up on a Monday morning, and that's what our front door is there to do, is to have that information, or from EDTs on the weekend, from the ward staff, to let us know. And what we're going to be doing in terms of a next step has been done in the Royal Glamorgan Hospital. It's a process of staff training in Prince Charles Hospital in reference to safe discharges. What is the process of discharge within Merthyr? What people can expect from us, and most importantly, what do we expect from a nurse when they're signing the discharge papers? Does that answer the first bit at all, Councillor Thomas?
Yes, that's good.
Yeah.
Thank you very much.
Okay. In terms of the overwhelmed, the last point of your comment, I think that the one thing about winter planning, I've been working within local authorities now for 26, 28 years, and we used to have winter pressures from September to about February, and then we used to have then periods then of redevelopment, and then periods when, you know, we used to get lots of people coming back from holidays and saying they're concerned about their parents or concerned about loved ones. Now we don't have that low, and we're busy 12 months of the year. So the key thing for us in terms of to make sure our staff aren't overwhelmed is that we get the basics right. So for instance, we give staff time, especially domiciliary staff, time to travel from Mr. Jones to Mr. Evans, and that they don't feel that they're rushing and rushing and rushing. We make sure that we're paying them a living wage so that they feel valued, and that we give them opportunities for training, specifically around safeguarding training, and keeping themselves safe, because if they're not healthy and happy themselves, it's difficult for them to do their jobs. The other things that we need to do as a leadership team, which all of us need to do, is to make sure that the members of staff are aware what they can expect from us in terms of support, and that can be anything from if they receive verbal abuse or whatever it is in the workplace, that we support them through that so that they feel supported and valued. The last thing that the Section 33 agreement and the working together does for us in terms of health is to make sure that we all know what our roles are, and therefore then a home carer on a Saturday evening who's visiting Mr. Jones doesn't feel that they need to do absolutely everything because the district nurse is going to be coming in half an hour, so that they don't feel that they're aware of what they need to do and what others need to do to support them, so they don't feel overwhelmed in that case. The last thing that we need to do, I think, in terms of people not feeling overwhelmed, is to make sure that people know if they're unsure where they need to do to ask for help, which I think is that element of from the cultural change, is to make sure then that people know who to ring, when to ring, and that support is available whilst they're working throughout 365 days. Is that okay?
That's very encouraging. Thank you very much.
That's okay.
Thank you, Rob. I see Matt's got his hand up. Wants to come in on this?
Yeah, may I? Thank you, Councillor. I think it's a really important point from the perspective of a scrutiny discussion. I think, Councillor, what we were trying to do there is balance the idea on the one hand that this is absolutely the right model for our population in Merthyr Tudful and in Cwm Morgannwg. We've got that growing number of older people living with multiple conditions who would really benefit from a greater continuity and coordination of care. So there's a real confidence about integrating health and social care in that regard. But it's not a panacea, and we shouldn't get too kind of doughy-eyed and overpromise on this. There's not a lot of new money in the system. There's been some recently. The Welsh Government's provided a pathway of care delays transformation grant, and there are some other resources around. But we all know, you know better than me, that are absolutely fundamental challenges to organisational budgets right now. And I think to pick up on Rob's point about, and Councillor Vokes says indeed in the introduction of the cultural barriers here, I think they're very real. We rehearse in the paper a number of structural challenges, and also note that there are very few parts of the UK that you can point to that can say, I've absolutely got this right, and can we just learn from them? But we have got a really clear plan. We've had milestones in the current calendar year, which we've largely met. We're behind on some of them for a level of transparency, but we're replanning those now. And we've got a clear set of objectives then in the medium term to take us up to the spring of 2027, where we've got a clear view of where we want to be at that point, and there'd be a further development phase beyond. So it's a strong plan, but I think we do need to balance that level of ambition for the population and this model with the pragmatism of it's going to be tough to deliver it. This is a bit of both.
Okay, thank you very much. Councillor Jenkins?
Thank you, Chair. All the questions that I had written down, everyone has answered already or asked. I just give you some of my background, and it's a question for Matt and Rob then together. I actually work as a hospice at home auxiliary nurse, and I work for the Nigel Bevan Trust, and I cover Powys. I'm one of the emergency discharge team. So I work as a lone worker. I go in on my own every night, and I've had a phone call now just before the meeting started to say that I got an emergency discharge patient who's due to pass away through the night. I'm an auxiliary nurse. They only accept band 3 and above in the firm that I work for. What worries me is that I started there 15 years ago, and we just covered cancer patients. Because of the increased capacity now, a lot of our patients, due to the hospital discharge, are increased dementia and elderly frail. What worries me is that the capacity of the social care that we've got at the moment and the level of training that the workers have. With a person coming out a rapid discharge, would they have the ability to look after that person at home? Because some of our staff wouldn't be chosen to go into that person, and this firm has been going a long time. And I'm worried that with a domiciliary care company, which we are the next step above, because domiciliary care companies come in as well as us, and I'm worried with a serious discharge, how would that person cope? Yeah. And it's an unfair situation to put somebody that isn't skilled and has enough work experience to cope with.
So if I can just thank you for your question, just to respond. So if somebody was being discharged from a hospital with a level of complexity as you're describing, we would be expecting our intermediate care services, as in the commissioned services that we provide the local authority, and also the hospital at home services, which have the availability in terms of occupational therapists and qualified nurses and a GP to support with that person to be safely discharged. Because you are quite right. The key thing at the hospital hubs when they receive an electronic request for a transfer of care is to look at what are the risks to that person, what are the risks to that family, what do we need to do in terms of providing services to keep their well-being high, and also what is around them that can support them in terms of, if they want daughter or son or whoever it is that's important to them to support them. So that's the balance in terms of the tendering process that we're going to be looking at for the straight to service model, is firstly to test it and to see if it works, and then secondly to make sure then that the people who are being referred are referred appropriately so that they're not then discharged at risk, because managing risk in a hospital environment is far easier than managing risk in a person's own home when they're on their own. And even if it's the simplest things that go wrong, such as there's no electric in the meter, and therefore then there's no heating and no lighting, we don't want to put our staff or the people in those risks as far as we possibly can. So as I said, that's where the hospital hubs are so important in triaging those the complexities, so that then the current pathways of care, which are pathway 1, which is a direct to service or a support from home, pathway 2, which is more of a rehabilitation approach, or pathway 3 then, which is supportive, a proportionate assessment to ensure that the person is discharged safely and effectively via a proportionate assessment done by a social worker. Does that answer?
Yeah, and just a bit extra then. Do you feel that the focus on developing the service is progressing at a speed that is acceptable?
I think that as a local authority officer, we always must be in the back of our mind, is this good for the people of Merthyr? And one of the things in terms of our integrated approach is to make sure that, yes, that we progress in a timely manner, but it's done safely in terms of the progression of our services. So, for instance, as I've mentioned, the direct-to-service model. So currently, if somebody needs to be discharged home with a modicum of support, one of our hospital discharge team meets them, has a conversation, has that discussion in terms of what matters, and then we use our intermediate care services. In the future, either this side or probably the other side of Christmas, we'll be looking at a trial where we use a trusted assessor model where the information from the ward staff is given directly to our intermediate care services, and we provide that service straight away. In order for us to do that, we need to make sure that things are okay. That's one of the reasons why we're participating in the sprint approach, to specifically look at the first 2 weeks of December to make sure we're getting that right.
Last question then, sorry.
Yeah.
With the palliative care ward closing in our local hospital, do you have the health staff available in the community to care for those patients who no longer have the service?
So I wouldn't be able to answer that in full because obviously...
Sorry, just for Matt, sorry.
Right,
for
okay.
Matt.
I might be in the same boat as Rob, with apologies, Councillor, but we can get an answer to you, information to you on that as quickly as possible, if that's okay.
Yes, please, thank you. Thank you very much. Thank you, Chair.
Councillor Isaac, you had your hand up, but it's down now. Have we moved on?
You've answered some of the questions I was going to ask, but I've got other things to say, so I think it'd be better said in comments more than questions.
Yeah. That's fine, thank you. A couple of questions from myself. It's in relation to paragraph 5.1, Rob. Obviously, the two academic reports are quoted in there about what people want, in effect, really. Has any specific consultation taking place with service users or their families directly within Merthyr Tudful?
So whenever we... Oh, sorry. Matt, do you want to go first?
Yeah, just to explain a little more, Councillor, about the examples given in 5.1. I think they were direct, I know they were direct conversations with people and and families. Perhaps the way that we've written it makes it sound a little academic. The Devon Commission meeting was a local one in the County Borough area, and the hackathon, as it's known, it's not a term I particularly like myself, but that was very much inviting people in with patients, people with experience, to hear from them directly about their needs and wants from local services. And we use that information at a regional level then to develop something called a population needs assessment, which is the basis then for the way that we plan programmes, the way then that local authorities and the health boards put together the services that are funded through regional resources such as the Regional Integration Fund and other areas. So they were, very much conversations with local people. I think most likely they built on as well locally with other engagements. Rob, so you might want to build on that, please.
Yeah, thanks, Matt. So discussions with the people who we work alongside with, as in people, carers, are always incorporated in reference to the assessments that we produce, and certainly is one of the themes for our development in terms of outcome-focused assessments, is to ensure that we specifically hear the voice of the individual in terms of what they want through the what matters conversation. And what we've also tried to do as well through the carers events that we've done. We've got another one, we had one yesterday down in the hub, is to ask carers, what is your experience in terms of the services that we provide, especially in when things are tense. How can we improve, and what is it that you would like in the future, so that we can hear what the people of Merthyr want.
Thank you. Thanks very much. I think you touched on my next question earlier, Rob. It would have been nice to have some practical examples of working together in the report, but I think you said you could provide us with case studies, perhaps in the not too distant future.
Well, we've got some case studies that we've already prepared. So what we can do as an outcome of this, I've got it here on my toolbar, so we can share them, and they can be shared with the minutes of the meeting.
And obviously respecting confidentiality, etc. Even those which are perhaps not that positive.
Yeah.
Because I'm sure there would be some, even if it's only a small minority. So we can see perhaps what you were doing to improve that situation then, really.
Yeah, no problem. We can get them shared with the minutes of the meeting. They've already been prepared just in case for this meeting.
Yeah, thanks. And my last question is in relation to sorry, I got two go to go. Sorry, 6.4. I didn't really understand paragraph 6.4.
Matt?
I think, thank you, Councillor. So I was just looking at it now. I think we were...
It may be worded, Matt, I think, more than anything, but...
Sure, the sense is, the paper's about integration of health and social care, and the model that we're moving towards for a number of those community-based services is integrated teams on a local footprint. One of the things that the regional partnership agreement will enable us to do down the line is potentially make joint appointments to management posts. So to try and create really effective teams, to put that under one leadership point rather than have a health board boss and a social care boss. These are decisions for organisations to make in the future rather than something that's already been determined. So it's largely what the model is, but we're also saying that there are parts of healthcare and indeed social care that won't be part of that integrated arrangement, but still remain really, really important. Primary care being the most obvious example for you as councillors. I expect you deal a lot with members of the public who, challenge or issues at least around access to primary care. So I think it was just simply pointing to that there are a number of issues outside of that bit of the Venn diagram that's the overlap, where councillors will want to take an interest. Some of the questions today, of course, about hospital-based services as well, and there are other means of engaging in those areas of service performance and service development that councillors might wish to seize on, or indeed officers, at least as a associate member of the health board, for example, to do that. So I think it's just pointing to those wider healthcare issues, councillor.
Thank you, Matt. I think you've answered my next question, which is on 7.3. What do you expect of members? Obviously, it's to bring issues to your attention, I'm assuming, that may arise via our mailboxes.
Please, yeah, really, I think Councillor Manette-Vokes gave an undertaking previously in full council to make sure there's a report back to councillors on progress with our plans here, to check that we're meeting our milestones, and fundamentally what the impacts are. So those indicators and performance measures that we describe earlier in the paper, hopefully over the coming months we'll be in a position to start to generate some reporting on those in terms of regional performance, but local performance as well. But the role of local members, I think, is essential, to sense check what the data might be showing us with the lived reality for people in communities. So one of the important pieces of work for the Regional Partnership Board over the next 18 months is the development of a new version of that population needs assessment. Well, I mentioned earlier that the citizen engagement events previously had fed into the last time around. So it would be great to have an opportunity, I think, over that time period to re-engage with councillors to sense test the direction of travel that needs assessment is taken, to make sure it fits with your understanding of the communities, of the people in your wards and the issues and opportunities that they face and have. So I'd be really pleased to be able to have an ongoing discussion with members about that. Thank you.
Thank you, Matt. Rob?
Yeah, and just reiterating, as Matt's saying, I know that we've started a programme of information sharing with you all. We all sat a few weeks ago, well, gosh, it was more than 3 weeks ago, it was a couple of months ago, wasn't it? Where we were talking about community occupational therapy services and the challenges for that. So certainly, for us to prepare briefings for elected members and obviously then for MPs and AMs as well is an option. And I think it's about then that two-way communication, because as well as us having a front door, you're all getting requests then from your constituents members then to say, I've had this as a difficulty or as a challenge, and can you support me with that? So yes, it's about that. It's that engagement between us all, isn't it?
Thank you. Any other questions before we move on to comments? Well, my apology, Lisa.
Sorry, I was just going to add, Matt and Rob did a good job of answering all the questions. I think the report shows the progress we've made in this arena, but we know we're very at early stages, so a lot of things will happen over the next 18 months. So I suppose if the councillors want to have that reassurance, we can bring reports to council, over the next 12 months to 18 months, so we can update as to where we're at. And also just to let you know that we've got a ministerial visit on Thursday. Obviously Welsh Government are interested in integration and where we're at with the pathway of care. So Rob is going to be attending that meeting with the Minister and the other two local authorities and Health Board to outline where we're at and obviously answer any questions the Minister's got.
Thank you, Lisa. And obviously we'll consider that in our forward work programme, not perhaps today, but it'll at least Jane will put it on the agenda for future discussion, because it would be good to have an update, as you said. So comments. Councillor Isaac had indicated he had a comment to make, so we'll go to him first.
Thank you, Chair. I do worry about the knock-on effect that the withdrawal of several essential specialised services from the local hospital will have on social services, in them having to care for the people whilst waiting transport to other hospitals. So I welcome Rob's project, Who Do I Ring? Because, there's always the background in these residents' minds of who do I ring? Do I ring the hospital? Do I ring the one they've been transferred to? So that is something I think you go and have a big problem with when these essential services are withdrawn. I also like to call into the what Claire said about who did she call in the middle of the night whilst she has a terminal patient. The ambulance service have a just in case box. So if that patient is having problems with pain relief or other things happening there, they will be able to supply that essential drugs. And then just returning back to social services, I've known of several cases where when the social services withdraw after the terminal patient has died, it's like a second burial, but I can't get the word out. Bereavement, thank you. To the family, where the team just disappear and they are left with equipment that needs to be returned to somewhere, but they don't know where to take it from. So I'm wondering if social services could help in just removing some of that equipment as well. Thank you.
Okay. Any other comments?
Yeah.
Councillor Claire Jones?
I would just like to say, go on.
Matt, would you want to come in first?
Apologies, Councillor, that was an old hand. Forgive me.
Oh. Councillor Claire Jones.
I would just like to thank you because you've answered our question thoroughly. And to be honest, I think you were thrown some really good questions by my colleagues and the lay member. My comment is your objective is a healthier Merthyr Tudful, a healthy Merthyr Tudful, and I welcome bringing something back next year for an update because it would be very interesting to see the progression within a 12 months. So firstly, I'd like to thank you. Very exceptional answers, and I look forward to seeing an update next year. So thank you ever so much.
Thank you, Claire. Any other comments? Okay, I'd just like to echo what Claire said, really. It's been quite a comprehensive afternoon, really, with both reports, but specifically this one has given us an insight then into the plans which are being put forward, and we wish you success with them. Before you leave, though, we as a committee have to determine whether this committee did address the recommendation in the report, and did we add value to the report? What are members' feelings?
Thank you so much. Thanks, Chair.
Okay, so thank you all for coming. We move into our, not a private session, but to discuss our forward work programme now. So if you wish to leave, there's no problem in you doing so. But if you want to stay, you're quite welcome to stay as well. Thank you very much. And have a good Christmas. We won't be meeting most probably, we'll our councillor colleagues will see one another between now and Christmas, but not perhaps everyone else. Thank you.
Thank you very much. Thank you all.
Okay, so we move on now to item number 7, which is the forward work programme.
I just got to say that was really good.
It was.
I thoroughly enjoyed that, and well, thank you ever so much for bringing forward.
And it's nice to see how far advanced Merthyr Council is. Not just Merthyr Council, our TAF.
Yeah.
Yeah, well done.
Because it's really progressed in the report, and it's nice to see us doing here.
Good. Yeah. It was good to be on the 2 items, I thought, today.
Yeah.
The forward work programme. Anything?
I'm actually freezing.
Because our next one, we've got the budget report, the 6th of January.
Yeah.
And are we still okay, Lisa, for the not-for-profit flowers update?
Yeah, I believe the report has already been written by Joe as well.
Oh, she's right. On point.
I don't think there's anything else to discuss on the forward work programme at the moment, and we perhaps look.
No, we filled all the dates.
We were all filled this year, I think, aren't we, Jane?
Yeah, we've got a quarterly capital meeting in December to look how our plan aligns with cabinet and resource.
Yes.
Yes, excellent.
And there are no scrutiny referrals. So that brings us to we haven't got any scrutiny feedback, Jane, I don't believe today, have we?
No.
So that brings us to the end of the meeting.
Thank you. Lovely.
Thank you all for attending.
Yeah, thank you.
And
Love
thank
to
you,
see
Thank you,
Stuart,
Chair.
for joining us today.
Yeah.
I hope you've enjoyed it.